this is always fun and exciting when we can show predictable and consistent results, and the method, of course, that we use to generate several leads, and in this case, over 24 new and fully qualified dental implant leads in just 7 days. So let's get right into it. Here is a great testimonial from a great client who maximizes her dental client revenue through actually generating more implants for them on a weekly basis. So this is what an average week looks like for a dental practice with a predictable and consistent patient lead generation system, and what the inbox looks like of the office manager. And as you can see here, they have a total of 24 leads that came through in that 1 week, and 24 total consultation forms for procedures that were ranging between $3,000 and $30,000 for a single to an all-on-4 in 1 week.
For me, in terms of actual weeks, I don't remember a week in my office like the week I just had in years. I mean, I just had multiple smiling dentist patients that all accepted referrals for their cone beam CAT scans. I must have about a dozen, full diagnostic records for ortho patients I didn't even have a chance to get to diagnose this week. Like, it was just insane. I've got a bag behind me with must be 40 charts. It was just crazy. But, at the end of the day, I mean, and we talked about this, I think, the first time in terms of, getting to each of those levels and then plateauing out and trying to identify why you get stuck at that level or why you get stuck at that plateau. As a general rule, it's your ability, yes, it's the processes and protocols in terms of being able to manage all that stuff. But at the end of the day, it's about, how those calls are being handled and how those people are getting those people in at the front, and I finally took Shamil's advice. So anyone who knows Shamil knows, he's a big fan of having having a separate cell phone, and, so that, you can reach out to these patients when they get to your practice as quickly as possible. And I've actually done that this week too. And we've managed to bring in a staff member who looks to be more than competent to be able to do this kind of stuff, and actually has a passion and a desire. And that's what you really need to do in finding these people, is that you've got people who really want to be there, really have to work and want to.
Here is the example of the qualification form they respond to daily, and the types of questions and detailed questions that they have to answer before they actually sit in your chair. And they do this every single day happily, using a predictable system that generates consistent qualified leads using their existing ad spend. If you are looking to do more higher margin implant procedures more frequently, then you need to look at the system, because this is exactly what it'll do for you. And as this dentist will tell you, he's booked out solid for 2 months.
It's going extremely well. And the thing that surprised me the most is that we're running let's say our funnel or our ads based on dentures, but over 50% of those patients immediately are putting on the form that they're interested in implants. So before even coming in the door, they already have it somewhat in their mind that, you know what, I was online, I've seen this before.
Right.
What can you tell me about this? Right. So that's immediate consultation, first try. So immediately they're asking me that. Now, next appointment, I have a denture already set up for them, some kind of a plan set in place with the DDS or with the dentist or even the oral surgeon, with some kind of not an upgrade plan, but an overdenture plan, because you asked about it originally.
If patient lead 39, for example, is ready to act after 35 years of being annoyed, and quite clearly has told you here her annoyance and described that annoyance to you. Patient lead 49 used caps to describe her pain. And as we all know, caps mean business, and she also told you that she wouldn't waste your time if she came in, because again, she's in pain. So 51 told you before they came in they had the means to pay, and clearly indicated that that he also would like to look at financing options. And they all want to buy within the next 90 days, and you just need to book their appointment. So you can prioritize them based on immediate need before they take your valuable billable time. And we all know how important that is. So In terms of gaps, you can never make up for a lost gap in your schedule that didn't translate into your maximum billable hour, but you can ensure that it never happens again in the future with a predictable system to generate new high margin patients consistently. At this moment, there are potential patients looking for help in your local market right now. This patient, for example, describes her pain that allows her to describe this in a setting, in a free setting. And you just need to know that she's out there at that moment looking to solve her problem and have her predictably come through your door instead of the door of another dentist. It really isn't about the business you currently have. You're always going to get that. It's about the business you never knew you missed. So really the question is, do you predictably and consistently generate new qualified implant patients monthly like this with a guaranteed measurable return on your investment? Do you want as many patient leads as you can reasonably handle that have the means to pay and are ready to act? Then let me show you the proof of patients in your market looking for a $3,000 to $30,000 implant right now. Just request your free consultation and we'll find out if we can do this in your market or not. And we always guarantee new qualified dental implant patient leads with no financial risk to you for trying it out. So the reason being is you saw the numbers. And that is why we guarantee results 100% of the time, because it's proven. And if somehow it's not for you, we will give you your money back. So it's risk-free to guarantee new pre-qualified implant patients daily. And all you need to do is book them into your schedule. Openly share the secrets we use with you to print money for dentists and the huge potential that you may be missing within your local market if you would like to perform more dental implant procedures. So if you have the capacity in your practice and you want more dental implant procedures, click on the big blue button today and we'll be happy to call you back.
Hi, I'm Dr. Chuck Lee with 7 Day Dental. I want to let you know that Busy 360 Dental Marketing Technology is making me that smiling dentist. I'm extremely happy that we got involved with them because they have helped us with a lot of implant and cosmetic marketing leads. And we are extremely happy, and we would recommend to all my other dentist friends all over the nation and the world. Thank you.